Hi, I'm Penny Gibbs, and my guest today is Dr. Shammy Noor. He's a GP in Lichfield and is also the chair of South East Staffs and Seisdon Peninsula Clinical Commissioning Group, working in partnership across the 6 CCGs in Staffordshire and Stoke-on-Trent. Hello, Shammy.
Hello, Penny.
It's a very odd time at the moment with coronavirus. How are things?
Yeah, well, it certainly is odd, and I'm very well, thank you. The adjustment to the lockdown has certainly been challenging, particularly around some of the logistics. I've got 2 school-age children, and although they are able to go to school as I'm a key worker, we have decided to keep them at home, and that's been interesting, having them running in and out of meetings.
It kind of picks up slightly what we wanted to talk about today, which was about your mental health and well-being. Now, you're kind of a bit of an expert in this field, aren't you? Because you've written a book and you've done many talks to and others outside of the CCG about mental health and well-being. Can you just tell us a little bit about how you've come to that and a bit about this book that you wrote?
Well, interestingly, I don't particularly have any professional training in mental health other than being a GP, but it all started when I had a number of patients about coming on to 10 years ago now, who I just started to explain depression and anxiety in a slightly different way to the traditional way that they'd seen it explained in the past. And suddenly it just sort of opened up a conversation which just wasn't there before. And many of them came back and they'd had some treatments, and they'd had some of them had had counselling, some of them had therapy, some of them had some medicines, and they'd come back and they'd said, why didn't I do this 40 years ago? Why have I wasted 40 years of my life with this illness, when actually by engaging with the treatments, it was perfectly treatable. And in many respects, they've sort of turned their lives around just with some really, really, really simple basic measures that have actually been around for many, many, many years. So I looked at this and I took on board, the feedback I'd got from these patients. I thought, well, how did we break this barrier down? So I tried this explanation with different people, and it seemed to work with lots of other people as well. So I decided to write this down in a book, and the feedback on that has been fantastic. And I do talks to patient groups, to other NHS staff, to the public generally, and generally they've been very, very well received. I think there are so many stigmas surrounding anxiety and depression that, unlike any other illness, people don't engage, and they don't want to think of themselves as having this illness. And actually, if you just change the way you explain it, change the way people think about it, suddenly they will engage, they'll have some treatments, and the vast majority will come back and say, why didn't I do this years ago?
So, interestingly then, if you're at the beginning of that journey that you've just described, how would someone know that their own mental health and well-being is being affected? Is there a difference?
There is, yeah, and it is difficult because there are lots of aspects of mental health which cross over with normal human emotion as well. But there is a difference. So we're living in this lockdown. We see COVID and coronavirus and deaths and things on the news day in, day out. There's a government briefing at 5 o'clock every day, and this is really, really, really being pushed hard for all the right reasons. So it's quite normal to have a degree of anxiety, to have a degree of worry, to have a degree of wariness about how you go about doing your day-to-day business, and it's quite normal to have a degree of thinking about the future and thinking about what might happen, not only with people's health, but also with their money, with their jobs, how they're going to get about, what they're going to do with their children, what they're doing with their families that many people haven't seen for a long time. It's quite normal to have a degree of worry about that. This is a normal human emotion in the situation that we find themselves in. So the difference is when people start to suffer with a condition like anxiety or depression, there are certain differences, and there are certain ways you can tell the difference between that and what's normal. So one of the ways that I find quite useful to think about is this idea of ruminating. So when somebody's suffering with anxiety, rather than the thoughts coming into their heads, which happens to many people, about what might happen, what I call the what if scenario, That thought would normally come into somebody's head and it would process through, and then at some point it would leave their mind and they could use the rest of their brain function for the rest of that day to get on with the other things that they need to do for that day. What tends to happen with somebody with anxiety is that thought process starts to ruminate. So instead of going in and going through and going out, it kind of goes A, B, C, and instead of going D, it goes B, C, B, C, and it ruminates, it swirls round and round and round in the mind. And then what's really important then is there's another bit of the mind which starts to fight with it, and it says, shut up, leave it, shut up, leave it, shut up, leave it. But that what if keeps going round, that scenario keeps going around, yeah, but what if, yeah, but what if, yeah, but what if, shut up, leave it, yeah, but what if, shut up, leave it, what, yeah, but what if. And that's anxiety. That's the difference between a normal state of worry and human emotion associated with what's going on and anxiety. It's that battle that develops, and then it produces all sorts of physical and mental health symptoms as a result of that.
So how would that person react then? Because obviously if that's yourself, I suppose some people may hide that because they're embarrassed, or like you say, this stigma. What kind of ways would they be reacting to it? Is there certain signs that you would spot? So say if it was a neighbour or a relative you're worried about, what kind of things might you see that would make you think that they might need help?
It can be difficult to spot, but it does produce a whole range of symptoms that certainly people notice themselves, and other people can notice as well. One of the big ones is something we call anhedonia, which is the inability to enjoy the things that they normally enjoy. So people who would normally enjoy watching a certain TV program or watching sport or doing some exercise suddenly stop feeling the joy in it. And that's something you can spot in a neighbour or a friend or a relative. The other thing that can happen is people can get incredibly angry. So when they've got this bee buzzing round in their head, round and round and round, these thoughts that are just impossible to get rid of, this ruminating over and over and over, suddenly little things around them become very irritable. Sometimes sleep can be affected, sometimes the way people eat can be affected. So it's all of these little subtle changes that can perhaps help you broach the conversation with that individual if you're worried about them.
Would the same go for children or young people? Because obviously at the moment, being an adult, you can kind of understand some of the reasons for the changes and the way things are going. But I've got little people at home too, and there must be some anxiety for them that they're going through. What kind of ways may they be showing that their worries through this?
Anxiety in children can present itself in numerous ways. They can be more temperamental. They can not want to engage with the things that they enjoy doing. They may become more insular, not wanting in the way they eat, in the way they behave around their siblings. Of course, the younger the child, the more this sort of thing happens anyway. So it can be really, really tricky. Generally speaking, the parents are normally in a relatively good position to notice that difference because they know their child and they know that these things might be happening. It's important not to overdiagnose it as well, because of course children can change their temperament very quickly for lots of other reasons as well. So not every change is to do with a mental health condition.
So once somebody has identified that they perhaps have got some mental health or well-being concerns, or maybe a relative that they've noticed these changes in, what are the things that they can do to help at the moment?
There are a number of things that people can do, ranging from the very, very simple things that they can do themselves, right up towards the more invasive things that they can do with the help of their doctor. So the most simple thing I can suggest is that there are a number of websites that people can visit. The first one is the Every Mind Matters campaign run by the NHS, which you can get on nhs.uk. And this has got a number of resources to help people who are struggling with their mental health and well-being because of COVID. And it has advice for adults, young people, working from home, being on furlough and things like that. A couple of other sites run by charities. Firstly, it's worth mentioning the Mind charity. So mind.org.uk have got an excellent set of resources, including some relaxation techniques and games and puzzles. The other one that I probably like to recommend is the Mental Health UK charity and website. So this is mentalhealth-uk.org. And if you go to that website, again, they've got all sorts of information on how to manage your mental health, specific information about key workers, information for key workers who might be the only contact for certain members of society. There's a few things which I'll probably just point listeners to. Firstly, there's an awful lot of evidence that's come out in the last 10 to 20 years about the value of mindfulness. Now, I've mentioned it because it's relatively easy to get into. If you look around, you can probably find some free apps and some free websites, and lots of companies like gyms are doing some free sessions that people can look at. And this has been shown in research to have a positive effect on anxiety and depression.
Can you just describe what mindfulness is, Shammy, for those that perhaps have never heard it before?
Sure. So mindfulness is actually not just one single technique, but a range of techniques which try to focus the mind on a specific bodily feeling, and by doing that, it helps to alleviate some of those symptoms. There are all sorts of different variations of it, and different things work for different people. The other couple of things that I think it really important to mention. So there are all sorts of therapies which have been studied for an awful lot longer than things like mindfulness. And cognitive behavioural therapy is the main one. This is a therapy where patients try to link the effects of their thought processes, the behaviours, and their emotions. And by using these techniques, that researchers found categorically that this has a very, very positive effect on people who are suffering from anxiety and depression. All of these things, they work sometimes really well for some people, and they don't work for other people, and that's fine. What people mustn't do is feel disheartened if it hasn't worked for them, because often people can sort of think, well, you know, my friend was in the same boat as me and they did this and it worked for them, and then that can be quite demoralizing. If you are still struggling, absolutely go and see your doctor, because there are all sorts of treatments. There's medicines, there's other forms of therapy treatment that they may be able to offer you. And it's really important to go and have a chat with your doctor and get a really, really good understanding about what all of these different things are. Often people don't do that because they have a preconception of what might entail or what that might mean. And one of the things I hear a lot is people don't want to go down that route. By that route, they have a preconception of what all of these different things are. And it's a crying shame, because sometimes there are interventions and treatments that can be really successful, but people never take that first step because of a preconception of what that might mean. I would keep a really, really open mind about going to see your doctor about mental health conditions, anxiety and depression, and they ought to be able to help you with it in most circumstances.
What was reassuring when the lockdown started was that the government obviously is allowing people to do a daily exercise, which I would imagine supports people's well-being as well as. Can you just describe like how important this is? I mean, I don't know about yourself, but I've definitely noticed an increase in people walking their dogs or doing some kind of exercise with their family, perhaps not on more duller days like today. But can you just describe why that is actually a really good way of supporting somebody's mental health and well-being?
Exercise is obviously very good for your physical health. We all know that, and we're educated about that. So it helps with your heart health, it helps with your aerobic capacity and fitness levels, it helps with your blood pressure. But also there's been a lot of research over the last 10 to 20 years on its effect on mental health. So for example, there was a study from Harvard about 10, 15 years ago, which showed that for people who suffer with depression, 15 minutes of even light exercise on a daily basis has got a 25% chance of reducing your risk of going into another relapse of depression, which is very, very significant. And some of these studies have even shown that this sort of thing can be as effective as medicines. So it's kind of a win-win exercise. It helps with your physical health in all of those good ways. It helps you get in shape, but also it can help with your mental health as well.
Thank you, Shammy, for all that advice and tips. I think our listeners will really find some of that useful. Before we do go, if you got the chance to speak to one person to make a difference today, whoever it might be, what advice would you give them?
The one thing that we've really, really seen a lot of and have been a little bit surprised about over the last 4 weeks are not using the NHS services when they need them. So yes, we have set things up such that we want to make sure that the COVID outbreak is contained. However, I think there are a lot of people out there that have been worried about using their GP services, or even in people having strokes and things, not using A&E for worry about overwhelming the service or catching coronavirus. But if there's one thing I can say is that the NHS is open. Your GP practice is open. We are in an unusual position where actually for a telephone appointment at least it's relatively quick and easy to get one. So if you are struggling with well-being, if you are struggling with your mental health, give your practice a call. They are open and they will be there to help you.
Thank you so much, Shammy.